Today, we're talking about the long road back from a severe hand injury. And let me tell you, it is a journey. It's not just about mending bones. It's about rebuilding a life, piece by piece. So let's dive into what that really takes.
Just stop and think for a second about everything your hands do. I mean, they're how we communicate, how we create things, how we connect with the people we care about. They are, in a very real way, essential to who we are.
Well, the impact is it's so much more than just the physical pain. It's a sudden, complete disruption of a person's life, their identity, and their independence. Everything changes in an instant.
So to really understand what recovery means, we have to look way deeper than just the surface. This is about so much more than a broken bone. It's about all the hidden depths of what's been lost.
Imagine it. The simple things we take for granted every single day, getting dressed, making breakfast, going to work, are suddenly gone. Impossible. And that loss of function, that's not just a physical problem. It's a huge psychological blow.
Okay, so let's get into the first critical stage, the acute phase. This is right after the injury. The clock is ticking, and a whole team of specialists has to come together to manage this immediate crisis.
And we're not just talking about a simple fracture here. No. Complex trauma means multiple systems are all damaged at once. You've got the bones, the tendons that let you move, and the incredibly delicate nerves that give you sensation. It's a mess.
And this is exactly why you need a whole team from day one. You've got surgeons rebuilding the hand structure, but at the same time, you've got occupational therapists right there, already fighting to prevent the long-term stiffness that can be just as disabling as the injury itself.
All right, so once that initial crisis is under control, the real work begins. This is the rehab phase, and it's all about methodically, carefully rebuilding from the ground up.
You know, one of the first big hurdles is the body's own healing process. Scar tissue is basically the body's natural patch-up job. But if it doesn't form the right way, it can act like biological superglue, just freezing up joints and permanently restricting movement.
And you can see the problem right here. Healthy skin has these nice, orderly, flexible fibers. But scar tissue, it's just a tangled, rigid mess. So the whole goal of therapy is to remodel that mess, to convince it to become more flexible and forgiving.
But even with the best scar management, stiffness, or what doctors call contracture, is a huge battle. So what do you do when a joint is already starting to lock up? How do you fight back?
Well, the answer often involves some pretty cool tech, and the results can be, wow, really dramatic. How dramatic? How about a 62% improvement?
Yep, that 62% increase in movement came from something called a dynamic splint. Now, unlike a hard cast, this thing applies a really gentle but constant stretch for hours at a time. It's this slow, steady persuasion that convinces those stiff tissues to finally let go and lengthen out.
And what about when the nerves themselves are damaged? It's not just about moving, it's about feeling. Nerves regrow so slowly. We're talking about a single millimeter a day. So sensory re-education is basically like teaching the brain a whole new language, helping it make sense of all the weird, fuzzy signals coming from that healing hand.
And you know what? A huge amount of this recovery happens at home. There was even a study that found a good, structured home program can be just as effective as formal therapy. And you can see how carefully it progresses. You start gently with massage, then add some stretching, then move on to fine motor skills, and only then do you start to build strength. It's a step-by-step process of taking back control.
So why is all this so important? Because getting a head start on therapy has a massive real-world impact. Look at this. One study showed that patients who started moving early got back to work an average of 11 days sooner. That is a huge deal.
But fixing the bones, the tendons, the skin, that's only half the story. There's this other injury, the one you can't see, and that psychological battle is every bit as real and needs just as much attention.
I mean, just look at this table. The connection is undeniable. You can draw a straight line from things like how bad the injury was and how long rehab takes to serious psychological outcomes like PTSD, anxiety, and depression. The physical and the mental are completely intertwined. In this quote, this just makes it all so real. This isn't just about feeling down. It's about a fundamental change in how people see themselves. The visible reminders of the trauma can lead to feeling isolated and dealing with a profound sense of loss.
So here's the bottom line. Psychological support is not an optional add-on. It's not a luxury. It is a critical, non-negotiable part of recovery. Without it, a patient might get some movement back, but they may never truly heal. So, after this incredibly long and difficult journey, what's the end goal? It's about pulling all these different pieces together to reclaim a meaningful, functional life.
And this is a really important idea. The goal isn't always to get a perfect, back-to-normal hand. Success has to be redefined. It's about getting the absolute most function you possibly can with the least amount of pain and empowering the person to live a full life in their new normal.
Which brings us right back around to the team. You can see how every single specialist plays a vital role here. The surgeons rebuild the structure, the therapists guide the physical recovery, and the psychiatrists address that unseen mental trauma. It truly takes a village.
Ultimately, this whole journey teaches us a powerful lesson, that real healing is never just about fixing what you can see on the surface. And it leaves us with a bigger question to think about. If true recovery from any injury has to address both the body and the mind, how might that change the way we approach all kinds of healing?